Fibroids can be a very big deal and a very big problem for many women. And here to talk to us about it is Dr. Christine Helou with GBMC Health Partners Gynecology. Thank you so much for being with us.
Thanks so much for having me.
So I want to start out just by asking what exactly fibroids are and what are the symptoms if the woman has them?
Sure. So fibroids are definitely a common problem that probably about 80% of women will have by the time they get to menopause. They are really tumors. They're benign tumors, but they come from the muscle that lines the walls of the uterus. They can cause symptoms really based on their size and location, kind of like real estate. So some common symptoms we often see are heavy or irregular bleeding, pain or pressure symptoms, low back pain, constipation.
So it's a plethora of problems. And I think, when does someone really know that the fibroids have to be removed? I think a lot of the symptoms that you talked about, women just sort of experience monthly, but how do you know when it is actually a problem that needs to be dealt with by a medical professional?
Sure. So it really depends on the symptoms they're causing. So for bleeding, most women will pick up pretty quickly on very heavy bleeding that's kind of outside of their norm. Of course, if they start having symptoms that are suggestive of anemia, that's something we need to evaluate for, and based on that may lead us to treat them one way or the other. Sometimes they can be an issue for those trying to conceive and during pregnancy. Otherwise, it's a quality of life issue.
Okay, got it. So you don't necessarily have to have them removed, correct? And if you do,
Correct.
would it be inpatient, outpatient? What are some of the procedures to rectify it?
Sure. So it very much depends on the number, the size, again, the location of the fibroids to determine how we would access them. Some fibroids can be removed as a same-day outpatient procedure where we actually don't need to make any incisions. We would go all through the cervix. Other ones may need a abdominal approach. So whether that's a minimally invasive technique like laparoscopy or a larger procedure for some of these really, really large fibroids. It just depends.
It depends. It depends on the woman and the symptoms and the actual size of these fibroids. Okay. So if someone is watching and they're like, you know what, these symptoms actually sound like something I'm dealing with or a loved one is dealing with, how can they get in touch with your practice? And how do you see patients? Do you see them on location, virtually right now? How is it in the age of COVID?
Sure. So I would love to see these patients. I currently see patients both in person and through telemedicine out of our brand new Padonia office, as well as the main GBMC campus.
Perfect. Dr. Christine Helou, thank you so much for being with us and shedding light on this. We really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.
Thanks so much.